Hi, it's Edwin Jackson, pulmonarypocus.com. Here we're going to focus on getting from that parasternal long axis view to the parasternal short axis view. Probe indicators, you can see the red button there is now pointed towards the patient's left shoulder. That's a 90-degree rotation from where we were before. The previous video in this script will show you how we got there. In the parasternal short axis view, as you can see here, you're going to see the mitral valve and you're going to see the left ventricle. And this is really an interesting view because it shows you the right ventricular anatomy. And it shows you that the right ventricle is actually wrapped around the left ventricle. So let's take a look at some anatomy here. We won't get into the segmental wall motion of this view. That's something that we'll save for the advanced critical care echo portion. But here you're seeing the mitral valves here. All right, so we're going to have anterior and posterior leaflets. That's kind of that fish mouth view. Interventricular septum. This is going to be your right ventricle and right ventricular outflow tract. And you're wanting to see nice squeeze here. From this view, you're going to be able to do several things. You can go down to the papillary muscle view, which is here. All right, so now you can see more of the bulk of the LV, and you can see your papillary muscles here. This is the anterior lateral papillary muscle and posterior medial. You're losing your right ventricle here a little bit, but you can still see the interventricular septum. We can go further down in this view, and we're going to do a movement called tilting the probe, which we'll go over. And now you're really down in the apex. RV's gone, papillary muscles are gone, and you're just seeing the apex of the left ventricle. Last view we can look at from here, this is going to be your aortic valve view. So this is a great view for you to understand because you can get a lot from this view. I'm going to go ahead and pause the video here, and we're going to go over some of the valvular anatomy. So if we look at from 6 o'clock, which is right here, all right, this is going to be your left atrium. This is going to be your intraatrial septum. And it's important to remember the intraatrial septum. The intraatrial septum is going to tell you what aortic valve cusp or what aortic valve leaflet is adjacent to it. So if you see the intraatrial septum, that means that this is the non-coronary cusp. Intraatrial septum goes right into the non-coronary cusp. So from the intraatrial septum, we're going to have right atrium. Tricuspid valve is going to be here. Right ventricular outflow tract. Pulmonary valve. Again, notice how the right ventricle is wrapped around the left ventricle. Pulmonary valve, pulmonary artery. Now let's focus in on the rest of the aortic valve anatomy. I told you the intraatrial septum is contiguous with the non-coronary cusp. You know that this is the right ventricular outflow tract and right ventricle, so that's going to make that the right coronary cusp. And then this is going to be your left. Okay? So non-right, left. Again, basilar anatomy, something that you should be familiar with, something that's going to help you build into that advanced critical care echo examination.